Health inequalities are one of the most persistent and pressing challenges facing the NHS and wider public services. Today's forum brings together leaders from across the system, from policy and commissioning to frontline care and community engagement, to ask the hard questions and share the practical solutions. What makes this event so important is the breadth of voices and the willingness to move from beyond rhetoric to action. Health inequalities are deeply rooted, but they're not inevitable. And the more that we come together with honesty, ambition, and practical intent, the more we can begin to shift outcomes. There's a role for all of us in this agenda, and the HSJ Reducing Health Inequalities Forum is helping us turn insight into impact.
Health inequalities are everyone's business. There's so many things going on in the world, there's so many distractions, and it's really important for us to have a clear focus so that we can all work together towards a common goal. It's fantastic to frame it around the 10-year plan and focus on the practical actions to make sure we're all on the same page and we can have these great discussions to find out what our next steps are and how we can improve life expectancy for the most deprived in our population.
At the moment, money is a big challenge and a priority for all of us, but addressing the challenges that we've got through the lens of equity remains a core value. Yes, we need to deal with the acute challenges that we have, but if we don't stay focused on what is our medium and our long-term goal, then we just build another layer of problem in that we have to solve further down the line.
My session was on early intervention and prevention in type 2 diabetes and engaging and empowering communities. The key takeaways were around shifting power to communities, involving those people most at risk of type 2 diabetes in their care, and recognising the barriers they might be facing to accessing traditional services and how we need to work collaboratively to change that.
At Cancer Research, we're really interested in reducing inequalities. So the focus was not just on what inequalities are relevant for cancer, but also what we can do about them, whether in terms of national policy, but particularly in terms of what local NHS trusts can do to make their services more accessible.
The theme of our IDG today was improving access and care for people who are experiencing homelessness. There is systemic exclusion of people experiencing homelessness from the healthcare system, the physical exclusion from primary practitioners, right through to digital exclusion, so not having access to a cell phone and not being able to contact your general practitioner.
The thing I most enjoyed was the conversation we had about targets, data. All that stuff's quite boring and technocratic, but actually having health inequalities at the heart of that means that no one can ignore the problem. We can put improvement for communities across the country front and centre of performance management of the NHS, and I think that's going to be so critical over the years ahead.
It's been a really good day. Seeing the breadth of the work that colleagues are doing around the country gives you that extra hope and ambition as well.
It's just that chance to network, to talk to other people. That's really important to hear what's working and how we can work together.
Novartis have been partner with HSJ for the past 3 years. We see this as a huge opportunity to meet the decision makers. It makes sense that we are a partner and we speak to the individuals that will be here.
Health inequalities is not just a bolt-on. It needs to be embedded in every bit of work which we are doing, making sure no one is left behind. I think that's most important.